left employed practice in 2018 and decided to take a chance and become a publisher of a print magazine because we all know how important digital things are, but there's nothing like holding a magazine in your hands. And I had this vision to create a journal-like magazine that would bring back the beauty of medicine. Everybody's silencing doctors. And I take personal responsibility. We gave everything away to administration, to powers bigger than us. And it's like saying to a fine chef that you don't know what you know, and from here on in, you're not allowed to invent your own recipes or create your own recipes. You will work at Panera, and Panera is the only thing you will serve and cook. And medicine has become a series of algorithms with a lot of helpers, and they're squashing our ability to critically think and to take care of our patients. Physician Outlook publishes all kinds of stories and art. So we're all physicians, all really healthcare providers, all patients. We all have this innate beauty, talent, and we need to highlight it. We are the official publication of the American College of Healthcare Trustees, and we work collaboratively because those administrators, the nurse leaders, the IT people, our CFOs, I believe all that enter healthcare enter with good intentions. Something wears them down and makes them operate. I think ethically all of us are challenged in the system that's created. ACHT brings us back to why we are in the healthcare. It's to serve our patients. We're servant leaders, and we need to stand up for that and not allow the system to put profits over patients, to put algorithms over critical thinking. Anyone wants a magazine, please contact us at www.physicianoutlook.com, or even better, join the American College of Healthcare Trustees, where you get a full year subscription and all the perks and benefits of being a fellow and also a subscriber to the magazine.
Why are we different than other brokers? We're benefit advisors and we lead our clients. An advisor leads, a broker sells insurance. A broker represents a buyer, the employer, and the seller, the insurance company. And there's no other job in America where the broker represents both parties. So we work for employers, and employers pay us direct. And we work on building employer-built health plans, meaning we literally deconstructed the whole healthcare system and rebuilt it brick by brick. So we help the employers build their plans, where most employers are buying insurance, and we call those insurer-built plans. They're built by the insurance company, and they don't help deliver better care, and they certainly don't save money. They end up costing a lot more. The laws, the Affordable Care Act, where it did so many good things, it did something called the medical loss ratio, which the insurance companies now operate under certain parameters. And the only way insurance companies could make more money was the more the cost of care went up, their little percent of profit went up. So what happened over time is, if you looked at the stock prices of the insurance companies since the Affordable Care Act came on, they're up 1,000% since March of 2010. I think that a great question that any employer should ask their employees is how many of you would vote for single payer? And I think 99% of the employees that work at the plans we built would say, heck no, we got it great. We have no deductible. We have hardly any out of pocket at all. We pay a little bit for our insurance, and we have these unbelievable benefits. We can go anywhere in America to get care. We're not told we can only go here. You can't go to this hospital. They can go anywhere they want. When you have insurance with a $6,000 deductible and $10,000 out of pocket, you're functionally uninsured. You don't have insurance. You are broke if you go into the hospital. That law hurts us all because everywhere in America, when you want to use a service, you want to buy food, you know what the price is, you know what you're getting. It's the only thing in America we purchase without knowing the price up front.
I'm Cristin Dickerson. I am a practicing radiologist, and I'm the founder and CEO of Green Imaging out of Houston, Texas. They would not have to be in Texas, and they don't have to have us through a health plan. Actually, we started green imaging as a solution for patients who were either uninsured or had high deductibles. If you are not going to meet your deductible this year, you are a self-pay patient. You should be a self-pay patient, because typically cash rates are going to be better than the contracted rates, especially if you're in a hospital system. And patients frequently don't know that they're in a hospital system. With green imaging in Houston, where we've been doing this for 10 years, a patient would pay $75 for the x-ray, and that would include, it wouldn't be like the hospital system where the hospital's going to bill for the x-ray itself and the radiology group is going to bill for the interpretation. That $75 includes everything. We have an intentionally broken system that's basically driving profit for the insurance companies, the pharmaceutical companies, and the hospital systems. I think the first thing we can do is better primary care. Subscription-based primary care is something we can do that holds down cost 30 to 50% and gets so much better outcomes. The primary care physician can actually be the Sherpa that gets the patient to the best of everything and the highest quality, most affordable option for everything, whether that's medicines, whether it's labs, whether it's imaging, whether it's surgeries, whether it's specialist visits. All of those things they're great solutions out there. We just need the Sherpas to get these patients to the right place.
You are in need of a procedure, you have insurance. Wouldn't it be nice to know what a fair market value for that is before you go in? Because maybe your deductible is going to be even more than that, and you're going to be paying for the whole thing out of pocket anyways, right? I think one of the things that people don't appreciate is that their whatever that deductible is, $5,000, $8,000, $10,000, that is all coming out of your pocket, right? So when you go in and you see that, oh, an endoscopy is going to cost me $4,000, maybe you can get the endoscopy done for $2,000, because it's 2 or 4. Regardless, you're paying for the whole thing because your deductible is $5,000. When you talk about alternative care, in our opinion, the allopathic medicine as we have been practicing it, and of course I'm an allopath myself, doesn't fit everyone, so it's not ideal, for example, for someone who has back pain to only be going through the traditional care, right? Because there are great evidence to suggest that acupuncture and massage and yoga and all of those things may actually work better, right, than just pharmacotherapy. And when the consumer becomes the payer as well, right, that's where you really have the power. Because otherwise the payer is the insurance company. Should the hospital listen to you or the insurance company, right? And money always wins. So whoever's paying the bills, they're going to listen to that. Our answer to all of these really is that the best that we can do is to bring you transparency, right? How much something should cost, and access. Where can you go to get it, right? And then we hope that that those two are going to be enough for you to be able to take care of whatever issue that you may need. Our network is available on the browser, of course, through the internet. But we also have a native app for iOS, for Apple phones, as well as for Android phones.
We're a nationwide network of board-certified surgeons that focus and work mainly at ambulatory surgery center, but also at hospitals. The reason it's different for employers working with exclusive surgery solutions instead of just standard insurance is because, there's so many reasons, but one of the top highlights would be that literally it's not just a referral network. We're literally a concierge team that's guiding their patients through, and it's really the health care that they deserve. So for the employer-based groups, it's a lot less expensive. We're doing a bundled care package, and in other words, it's a bundled claim package. It's got the physician bundled with the operating room and the anesthesiologist. Those three combined reduce the cost for the processing of the claimant and the payment and everything else. And we're handling all that internally. So what it does is it saves the employer thousands and thousands of dollars because we've cut mainly the big middleman right out of the middle, and we're just going direct primary care to board certified surgeons. The surgeons at hospitals love working with us just as well as anyone else. Why? Because they already know what they're going to get paid up front before they do the surgery. We saw the need for what we started was what's called a personal medical record, and we've developed that now into an app And the app is going to be that the patient themselves will gather and get all their material, all their information as they go to various surgeons. So think about it for a second. The last time, for example, in my personal record right now, I have an image of the iris of my eye. It was taken almost 5 to 8 years ago. I have now a base point that I can look at. The next time I go to an eye doctor, I'm going to say, okay, doc, I went to an eye surgeon 5 years ago. Here's what it looked like. How am I doing? We have behavioral health centers nationwide that we also do bundled claims with. So we're in the behavioral health space, especially with the residential treatment centers. We've been in that space for about 20 years, and we have over 150 locations nationwide for treating people with opioid addiction, trauma, stress, just fears, phobias, and some of the really deep mental issues that people need to deal with. We can work with employers to actually bundle that case so that they're treated really well, both the patient and the employer.
Exclusive means is that we only use vetted surgeons and we vet all of our providers. So we have a very exclusive network that are only board certified and vetted surgeons to perform any surgery. It's kind of the basics that you want to start with. So all of the surgeons mean that they go every 3 to 5 years, depending on the specialty they have, to actually go through their board. So they're always up to the latest technologies. It also means that they have to have all of their cases that they've done over that 3-year period have to be reviewed by the board. So you get the doctors that are doing the better jobs and the better outcomes because they have to, or they won't continue to be board certified. So it's an ongoing process in the medical community that everybody should expect as a bare minimum for you to practice. Go to esurgeries.com and fill out the information form.
We are a payroll company, benefits company, and we manage employee health care as well. And I'm also a pastor, and I'm also a chaplain for the Harris County Sheriff's Office. But I think health care should be more fair when it comes to providing the health care for people. And so I would like to see physicians being paid fairly. I would like to see patients being treated with quality and not by a number. People rely, that their lives are on the line when it comes to health care. They want to make sure that they're being treated fairly, not because of how old they are or not because it's rationalized health care. They want to feel important. A lot of companies are not providing health care, and they're losing thousands, if not hundreds of thousands, because employees calling in sick, getting injured, not able to show up to work. Now we're focused in Texas, but it's Agape professionals. They can reach it through me even.
Health payment disruption is the dynamic entailing all of these brilliant licensed health insurance agents and advisors for group benefits that are sick of the cartel. And you might ask, what is the cartel? BUCA, the acronym for the insurance oligopoly, Blue Cross, United, Cigna, Aetna, and whatever else letter I've forgotten. The white shoe advisors at Aon who keep the CFOs and HR departments trapped with these insurance companies, and the conglomerate health institutions that use politics to keep out competitors. It is not easy for employees to get these better alternatives just because of the inertia of the system. There are a class of advisors like Carl Schuessler, who presented tonight from Mitigate Partners. These guys are called Rosetta advisors, and on LinkedIn you can search Rosetta and find a bunch of them like Carl, who can get you direct contracting, cutting your costs, stopping the out-of-pocket liability for your employees, and rewarding the local providers that are more independent, ambulatory surgical centers, more DPC, direct primary care, to give workers a better deal. For the small group market and individuals, which is my market, it's harder for the small group CEOs to find out about people like me. Sharing is like a credit union compared to a bank. Most folks know what a credit union is right now. Not as many know what a sharing company is yet. But that's a similar dynamic that we're trying to get to, so folks know that there are alternatives that not only cost less, but will treat you better. People right now are really dissatisfied with the healthcare market from all of the COVID hysteria. For the employer that accepts the advisor's invitation to upgrade their benefits, they'll save half what they're paying, which is always nice. the workers can get lower out-of-pocket liability, including first dollar coverage, and also get any doctor they want to see versus the networks with which insurers handcuff choices for most employees.
So medical cannabis is cannabis that has medicinal value in different concentrations. Recreational cannabis, the primary purpose is to get you intoxicated. Now, being intoxicated may have medical benefits in that maybe it relaxes you and it helps you hit the delete button. So if we know there's potential for harm with THC-enriched cannabis and we want to push it down the pipeline to make it legal like alcohol, then why are we denying people medicinal hemp that does not have those adverse effects, does not have those risks? We're being totally hypocritical to have policies that say things like, you can't grow hemp in the state of Maryland unless you get a license from the Department of, the Maryland Department of Agriculture. Well, I got that license, $2,000, I had to get an FBI clearance, I had to do this, I had to do that. $3,000, $3,500 in, I can grow hemp. But what about the patient that wants to grow 2 plants? We've denied them access to something that they could get for 20 cents a gram, and we're making them buy it from dispensaries at $100 a gram. Now, I realize we want the tax money, but I have patients that live on fixed incomes, and $50 extra a month takes flesh out of them. We've been dealing with cannabis throughout human history. Cannabis evolved in parallel with humanity. There's a lot of people out there that would benefit without any significant risk of harm, and we don't even have a better option for them.
I'm an Eldercare consultant with Senior Sherpa, and I'm co-author of Brain Health as You Age, which is a book about dementia, brain health, and how do you protect your brain. The thing I would like to change the most for senior healthcare is education. People need to remember the brain is inside the body. So what you do to the body helps the brain, right? Eat healthy, exercise, fresh air, sunlight, brain exercises, scientifically validated brain exercises, not just crossword puzzles. So I think it's the same thing we used to do with kids, right? Keep them happy and healthy, deal with moods, deal with anxiety, mental health. We need to do that for adults as well. Just because you're older doesn't make it go away. Don't wait until there's a crisis. If the family thinks something might be wrong, let's start looking into it now.
The pavilion, a concept that is perhaps taking something like we're familiar with LA Fitness or Lifetime Fitness, which has a lot of nice things for people, but putting that on steroids so you actually can have a community center that has everything from healthcare to classes to one of the reasons I'm here and involved with ACHT and these wonderful people is to create this facility where physicians can practice as they. We're going to bring in investment, we're going to bring in jobs, we're going to raise the quality of life for people. In return, what we want is this area is designated as kind of a free trade zone. We're looking for partners, strategic partners. We want to put these around the globe. We'll start with one. But put them around the country. A lot of people are looking forward to when they can actually go to a pavilion. And hopefully soon that we're going to make that a reality.
It is through this eclectic, broad organization of the trustees that we're going to have more events, more teaching, more webinars, bringing disruptors and innovators together to give us a better healthcare market based on ethics, better decision making, and better governance. The governance, or government, is captured by the special interest. If we want to have a real market with affordable pricing and great choices, we have got to get more active, where our dissatisfaction should open our minds to being curious about what's out there, and by being curious, you will search out the solutions, and you will meet us and our fellow disruptors who are doing the work that needs to be done. Jim Graybeck, he's got Pavilion, which is going to revolutionize the entry point for healthcare. So many folks here are high on DPC, direct primary care, where you pay a monthly fee for a primary care doctor, which is great, especially for chronic patients, I think, or families. I think the DPC, the future, is going to be integrated, or maybe even arranged differently, like a near-site clinic where you locate a clinic near a bunch of employers. And it might be a pavilion that Mr. Graypeck is forming, where it's going to be an exciting Epcot-like atmosphere of health innovators and even non-health options. We need to think big on how we structure the healthcare of the future. It can't just be a big box hospital. They like self-diagnosis, they like yoga. I teach Kundalini yoga. They like their local fresh farm entrepreneurs. That's going to be a result of that curiosity where folks are going to think bigger about healthcare. We're going to revamp healthcare in every way for the humanity that we deserve.